With the Law in Medicine Risk Management Series, here's Victor Cotton.
Delay in diagnosis is the most common allegation made against physicians in the course of medical malpractice litigation. It's an allegation that can be made against any physician of any specialty, and it can be stated in a number of different ways. They might say you should have seen the patient sooner. They might say you should have taken a better history, done a more thorough examination. They might say you should have ordered a different test, responded to the test differently, interpreted the test differently. They say it in a number of different ways, but what it all adds up to is a delay in diagnosis. And of course, it's not really the delay in diagnosis that upsets people. It's that the delay in diagnosis often leads to a delay in treatment, and that compromises the patient's outcome for which they attempt to hold us responsible. The goal of this presentation is minimizing the risk of that occurrence. And to provide some structure for the talk, I've broken delays in diagnosis down into two broad mechanistic categories. If we think about how a delay might arise from an operational, mechanistic perspective, we might group them into two categories. The first category are delays related to seeing the patient. And in this situation, it's a relatively straightforward allegation. If you had seen this man sooner, none of these bad things would have happened. The second broad categories relate to delays in executing the diagnostic plan. In this situation, you saw the patient in a timely manner, but thereafter there were some flaws in the diagnostic plan, and that resulted in a delay in diagnosis. So two broad categories form the backbone of the talk. Let's start with delays related to seeing the patient. And let's suppose there's a patient out here. He lives a few miles from my office, and he's got some pretty serious medical problems. He needs a diagnosis and he needs treatment, or he's going to wind up with a very bad outcome. And let's suppose further that I know something about this man. Perhaps I saw him a few years ago in the office, but he never came back. Perhaps he had a new patient appointment last week, but he didn't keep it. Perhaps I covered for his doctor last weekend, and I talked to him on the phone, and I gave him some advice, but I was just covering. Perhaps his physician bounced this case off me in the doctor's lounge, a little curbside consult. Perhaps I know this person socially. Perhaps he's my friend. Perhaps he's my neighbor. Perhaps he attends my church. But he's out there. He's got a bad problem. He needs help, and I know something about him. And the first question from a legal perspective that we need to ask is, do I have to see him?